mentioned, we are going to introduce you to the inter-cluster sector collaboration. And so we'll be a joint presentation with my colleagues who are based in South Sudan, who will join us online. And we are very pleased to share with you one successful example of this ICAC experience. But before I hand over to them, I would like to explain to you what is it, this famous ICAC. Can I have the next slide, please? Or should I use that now? Okay, cool. So this acronym, I know it's not very elegant, but that has been chosen and voted via the collective. So we are now called the Inter-Cluster Sector Collaboration to make sure we encompass sector and cluster. What's important is the work we are doing collectively together. And it's true that has been discussed earlier or with a previous discussion on how important one it is to coordinate, but also to collaborate. So basically we are taking one step further the coordination process that it's existing at country level. So what do we do basically? We try to work together, to collaborate, to deliver an holistic approach package to the people in need. So one more time, like all of us here, we put the people at the center. It's a people-centered approach. And we look at what are their needs. And according to that, we will make sure we collaborate with the right clusters. So this collaboration is a set of 4 clusters as a core: WASH, food security, health, and nutrition. But we also do collaborate with other clusters according to the needs. So we do work a lot with protection colleagues, with CCCM, shelter, depending again on the context and the need of the population. So I will stop here, I think. Here you have a bit more definition. Maybe I add a bit because the key thing is really same place, same time, and for the same people. Okay, so I will stop here, and I think that will become more concrete with the example from South Sudan. So I will hand over to my colleague online, Isaac. Isaac, are you here?
Yes.
Cool.
All right,
Glad
thank
to
you.
hear you.
Thank you so much for the opportunity, colleagues. Good morning, good afternoon, good evening. My name is Isaac Malemungu Charles. I work for Save the Children, South Sudan Country Office, as I was a specialist, and earlier I worked for the WASH cluster as a roving coordinator. I'm thrilled to be part of one of the speaker. With me, my colleague from Nutrition Cluster, Maleng, we will be sharing experience of the inter-cluster sector collaboration lesson learned from South Sudan. This was the approach that was implemented. Yes, this was the approach that was implemented in 2021, stroke 2022, using South Sudan Humanitarian Fund. And yeah, where 17 priority counties were identified, and 6 were among the top. And these 17 counties, they were counties that these were counties that were having a high wasting, high food insecurity, poorest worst conditions, high morbidity rates, and among others. So the nutrition cluster, WASH cluster, food security and livelihood cluster, and GVV subcluster came together and set a target and implemented this approach in Greater Tonj. And in 2022, nutrition and WASH cluster partners intensified and continued with the approach. So basically, as my colleague Rachel mentioned, the approach framework is that there's a coordination, collaboration, and in terms of coordination, we ensure that vulnerable families get multiple services from different sectors. And in terms of collaboration, know your key health, WASH, FSL, and nutrition partners, and what they are doing and linkage to each other. The package that was provided for WASH kits were provided, that is soap, buckets, plus water treatment tablets to the caregivers of severe acute malnutrition children. Then demonstrations at households were conducted for correct use of the aqua tabs or the treatment tablets, and also hygiene promotion on good hygiene practice and sanitation messages were shared across in both in the facility and as well as in the community. In terms of food security and livelihood, there were establishment of kitchen gardens at the nutrition sites and as well as in the communities. So with this, I will stop here. I will hand over to my colleague Maleng, who will take us from with the other sectors. Then I will get back later. Over to you.
Thank you very much, Isaac Malamungu, and thanks to all colleagues who are in this call, those online and those in person. My name is Malang Ayok. I'm a roving nutrition cluster co-coordinator based in South Sudan. To continue with the intercluster sectoral collaboration, which good afternoon, colleagues. Okay, let me put on my video. I said to continue with the experience of the intercluster coordination that we put the action together with other clusters like WASH cluster and food security, nutrition, and then health and GBB. To continue with, as you have heard from Isaac, WASH cluster and nutrition have jointly implement the collaboration of different sectors in one of the state, which is Warab, in 3 counties of the state, that is Toy North, Toy East. And with that, what we did is what are the needs that we want from WASH cluster, and what are the needs that we want from nutrition cluster and other clusters like health, GBB, and food security. And when you look at the different clusters as highlighted in this presentation, you will find that as nutrition, we need support from health to give us some anti-malarial, such that we do testing and do other prevention measures. The same thing we do manage also diarrhea cases by providing zinc and ORS to the children with diarrhea. And the same thing, we do need other service from GBB, like mainstreaming of child protection and other risk mitigation. And this is particularly done at the nutrition side. So with this, these are some of the key things that we require from other sectors to do a joint action on the issues related to nutrition, WASH, and other sectors like food security and health. Next, please. And based on that joint action, which was done together by WASH and nutrition, this joint action implementation has shown some positive impacts. And as I said before, it has shown in one of the states, Warab state, in 3 counties, which you have seen in this presentation. In 2022, we did a modeling as nutrition cluster, WASH, and food security. And that modeling showed that the severity scale in these 3 counties was very high, which is at the level of 5, that is very high concern. And we classify these 3 counties to be the high concern counties, and we In 2023, the WASH cluster and even the nutrition cluster work together, implement both WASH activities and nutrition activities in these 3 counties. And after the joint implementation, when we did another analysis in 2023, it showed that when you come together, the other sectors, it has some improvement. And as you have seen, the severity has dropped from high, very high concern to medium concern. That is in 2023 compared to 2022 high concern and another one. Next one. Yeah, I think this is where I can stop from there. The experience that we got in South Sudan, in one of the states, we have shown the positive impact. Up to here, I will hand over to my colleague Isaac to go ahead with other presentation. And I may beg if you can allow me to leave the meeting, and then my colleague Isaac will continue. Thank you. Over to you, Isaac.
Thank you so much, Maleng, for that quick presentation. The second success story that was registered in the Greater Tonges were that the integration, the number targeted were exceeded. The clusters were able to reach to 8,000 SAM and imam caretakers that were provided with WAS services. And WAS packages were also provided at the health facilities. And the water supply in high global acute malnutrition prevalence communities. So this was the this was the interventions that were delivered. And more globally, fewer children suffering from diarrheal cases. There was also a vaccination of vitamin A and deworming at nutrition facilities. I think Maleng would have talked more on this, but I think he's rushing somewhere. And kitchen gardens at facility and household level were established, and there were follow-ups. Then a reduction in GVV as water sources are closer and less tension at the water points were also recorded. So let us move to the next. Yeah, in terms of coordination, the government staffs were fully involved in the assessments as well as project inception meetings. And in most of the states, the government, different directorates are the one chairing actually the cluster meetings and co-chaired by the WASH cluster. And there were also routine sharing of information among the other cluster partners like health, nutrition. So messages were all shared the same. And also hygiene promotion approach across all community volunteers were conducted, joint trainings, joint field visits were conducted, and donors were also provided with donors also provided a continuous support. The clusters updated the donors with all the progress, and yeah, the donors they really provided support. This is one of the quotes that was recorded when the nutrition and WAS cluster coordinators went on ground to document this approach. The code was that water as a catalyst for many approaches at the nutrition site level, including kitchen garden, safe cooking. Sorry. Yeah, so water was the catalyst for all the services that were provided. We can move next. Next, please. Okay. These are also some of the few quotes that were recorded by the beneficiaries. The women said, since the hand pumps has been installed, I feel more confident and trust myself. I feel less shy to engage in the relationship and will get married quicker. So this means that the water points are closer to the community. They clean themselves timely, and they look presentable. It's easy for them to get married, which is really a good success story recorded. And the other quote was that since water points is closer to our village, since then, we do not need anymore to fetch water from swamps, and we are more less at risk of being attacked and violated. This was also another good success that was achieved. And the last one, the beneficiaries quoted that it is so rewarding for us as mothers to see our children growing healthier, better nourished, with less diarrhea and cleaner. So this is another success that was recorded. Next. These are some of the challenges that in South Sudan we still face, though despite all the great efforts and results that we achieved, there's no clear strategy to sustain gains made in water and nutrition interventions. Uh, every year we prioritize locations and interventions are delivered, but after prioritizing another locations or other locations, then you see the same counties going back to the same vulnerabilities that were addressed a few years ago. And this mostly happens because of the weak government system or structures for continuous sustainability. And also lack of harmonized funding across the sectors. It's one of the big challenges that we face. This approach the clusters were able to achieve it because there was adequate funding from the humanitarian response funds, and the clusters were able to do it. But in most times, funding is not harmonized across the sectors. And then also little focus on prevention of malnutrition cases. It's still the same there. People look at more of action or treatment than prevention. So these are some of the challenges that we face in South Sudan clusters, and this needs to be addressed. And I feel it's important in this meeting that we have donors from different different countries, that these issues need to be addressed. I know it might be the same in as well in the other countries. Next, please. Yeah, as water and nutrition clusters, we commit to advocate with the donors and the government to provide resources to different sectors to support the intercluster sector approach. And we also commit to reinforce our focus on effective and accountable coordination between government, humanitarian actors, and partners. We also commit to scale up interventions to prevent malnutrition by targeting all children less than 5 years and pregnant and lactating women. Otherwise, thank you so much. I really appreciate it. Over.